Hey everyone, today I'll be talking about systemic lupus erythematosus. SLE is defined as an autoimmune disorder having multiple organ involvement. The question which arises is what causes SLE? The exact etiology of SLE is not known, but it is known to have strong genetic association. It can also be associated with certain infections. For example, it can be associated with Epstein-Barr virus. Also, it can be associated with certain toxins. For example, exposure to UV radiations. Now, the question which arises is, how does a patient of SLE present to you? He or she may complain of a rash, and these rash can be of two types. Either it can be a malar rash, as you can see in this diagram. This rash represents the shape of a butterfly, or there can be a discoid rash. As you can see in this diagram, it represents the shape of a coin. Also, there may be complaints related to synovitis. The patient can also complain of oral ulcers. Also, there can be complaints of hair loss, that is alopecia. Now, as I've already mentioned that SLE has multiple organ involvement, so there can be complaints pertaining to the renal system, or there can be complaints related to neurology. The question which arises is, how do we establish a diagnosis of SLE? You need to go for certain investigations. The first thing that you would do is perform a blood profile. This blood profile would indicate presence of anemia. Also, you would see that there is decreased WBC count as well as there is a decreased platelet count. Further, you need to go for some antibody testing. We can go for anti-nuclear antibody testing. Also, we can go for anti-Smith antibody testing. Then you can go for anti-dsDNA, that is double-stranded DNA antibody testing. And you can go for anti-phospholipid antibody. After doing the test for these antibodies, you can also go for a direct Coombs test, and you can also perform serum C3 levels. Once diagnosis of SLE is established, next thing you need to do is treat the patient of SLE. For that, the first line will always be medical management, in which we use steroids. Apart from steroids, you can also go for monoclonal antibodies, or you can go for intravenous immunoglobulins. In certain cases, you can also go for plasma pheresis. So this was all about SLE. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.